So my research area is entirely focused on protecting workers from extreme heat. And I chose this population because they're very vulnerable and have been overlooked for years. And climate change has increased the severity and duration of heat events, which has caused things to become even more imperative to have evidence-based solutions to protect these workers. And these evidence-based solutions are derived from high-quality original research. And so I work on developing that original research. Not only are workers susceptible to heat illness, so that would be heat exhaustion, heat stroke, but they're also susceptible to multiple different medical conditions, such as cardiac events, kidney injury and disease. They can have increased accidents due to cognitive and neurological impairments. And people don't realize the significant effect heat has because a lot of these medical conditions that are caused by heat are underreported. So the good news is that a lot of these evidence-based solutions are easy to implement and tend to be low cost. And the Occupational Health and Safety Administration, referred to as OSHA, they suggest implementing water, rest, and shade. And while I think that these three components are very critical, we need to bring all of our tools out of our toolbox to protect all workers. So some other solutions that can be implemented can be heat acclimatization, including body cooling garments, modifying activity based on the environment, and including education that focuses on signs and symptoms of heat illness. And this is just to name a few. There's a lot of different populations. It's about 40% of the US population that work in the heat. And so some of the susceptible industries include construction, agriculture, manufacturing, oil and gas, a lot of ones that are required to perform very physically demanding work and often wear PPE and are exposed to their indoor outdoor heat. So right now, there's multiple different states that have standards that protect the workers within their state. Right now, the Biden administration has actually mobilized a large federal action to protect workers by starting the rulemaking process for a federal heat stress standard. And so what this would do is it would require all employers that are covered under OSHA to implement specific heat solutions to protect their workers. So this is a massive step forward to protect everyone who performs physically demanding work in the heat. So I'd want people to think about how, yes, all workers are susceptible to heat illness and other medical conditions that are caused by heat, but there are specific populations within workers that are even more susceptible. So individuals living in poverty, individuals who are migrant workers, coming from small businesses, brown and black workers. And what I would want employers to know is that we need to act now. Climate conditions are not getting any better, and these evidence-based solutions, once they're implemented, heat illnesses are entirely preventable. And really no one should ever die from a preventable illness. So I became interested actually when I started my work in firefighters. And so during my undergrad degree, I did a lot of research initiatives, and this population was so fun to work in. And I actually remember this event very clearly. Is I was doing a research study, and the firefighters were going into a live burn. And the second that they opened the door, their physiology essentially shot up, like heart rate increased, blood pressure, and I was so affected by what I saw that I decided that there had to be something to do with just not firefighters, but a larger population of workers. as the new building is available for the College of Nursing and Health Sciences, there's going to be an environmental chamber in the Human Health Physiology Lab. And so what this will allow my research to do in collaboration with my colleagues in the Health Sciences Department is actually bringing in these workers who are susceptible to heat illness and testing them in a controlled environment. And so we can have a better idea of what prevention strategies are going to be most optimal. So I'm very excited to start that research process.